we have reduced murders by 51%. And January 2025 had the lowest monthly murder count since September 2014.
Our efforts have also resulted in the reduction of active gangs by 50%. We continue to increase firearm seizures, and in more communities, we are experiencing less violence. We will realize our vision of Jamaica as the place of choice to live, work, do business, raise families, and retire in peace and prosperity.
The proceeding was brought to you by the Office of the Prime Minister.
Cook it up and make us
that you will clear our minds, clear our thoughts, and guide the discussions, dear Lord, so that at the end of the day, these matters will be resolved in the best interest of our dear island, Jamaica, land we love. We ask these things in your precious name. Amen.
Thank you, Member Main. Given that we have portable AC units, which are a little loud, I'll just ask members to speak in the mic once you have the floor. Apologies for absence. I know Member Bunting is off the island, and Member Miller had indicated that she would be late, and Mrs. Hope Blake from the Ministry of Finance has tendered an apology. Are there any other apologies? Okay. Madam AG, could you introduce the team that is here with you?
Good morning, Chairman and members present. With me today, Mr. Chairman, is Christopher Hare, Deputy Auditor General for Non-Assurance, Ricardo Hall, Principal Auditor, Rochelle Bailey-Thomas, Acting Principal Auditor, Junior Thomas, Director, Alicia Powell-Bowen, Director, and Jennifer Hutchinson, Senior Auditor. Thanks.
Thank you. I know we have there are members from the parliamentary team who are here, or research officer. You just want to introduce yourself, please?
Morning, everyone. My name is Stephanie Hamilton. I'm the Senior Research Officer.
Okay.
Good morning, everyone. My name is Angelica Patterson, Research Officer.
Mr. Thomas, I think you're here alone today. Okay, just introduce yourself from the Ministry of Finance.
Good morning, all. I'm Barrington Thomas from the Ministry of Finance.
Thank you. Mr. Green, could you just introduce the team with you from the Ministry of Health and the University Hospital?
Thank you very much. Good morning, Chairman, members, Madam Auditor General and your team, colleagues all. I have with me this morning, to my right, Mr. Donovan Davis is the Principal Finance Officer of the Ministry of Health and Wellness, Mr. Howard Lynch, Chief Technical Director, Policy Planning Division, Commander Dr. Paul Wright, Chief Technical Director, Dr. Kimorley Humphrey, Principal Director, Mrs. Michelle Davis, Director of Management Accounts, Ms. Brendalyn Bennett, Audit Manager, Ms. Michelle Walker, Chief Internal Auditor, Ministry of Health and Wellness, and Ms. Maureen Golding, Chief Technical Director in the Office of the Permanent Secretary. I'll ask Mr. Hussein to introduce his team.
Thank you, Pierce. Good morning, Chair and members of the committee. With me this morning from the University Hospital of the West Indies is Mrs. Angela Curtis Cox, Senior Director, Strategic Planning and Project Management, Mr. Kimani Bryson, Senior Legal Officer, Ainsworth Buckridge, Senior Director, Procurement, Mr. Dwight McLeish, Chief Internal Auditor, and Valesha Dover, Director for Finance.
Thank you, Mr. Chai Chung. You just want to introduce yourself, and I think you have a former board member, Mrs. Thwaites, with you as well. Just press the button first. Yeah, go ahead.
Wayne Chai Chung, former board chairman for the University Hospital of the West Indies, and accompanying me is Mrs. Catherine Park-Thwaites, who was head or chair of the audit subcommittee of the board and also sat on the Finance and General Purpose Committee.
Thank you. Mr. Benjamin, just want to introduce yourself and the team from Customs.
Good morning. Kurt Benjamin, Acting CEO, Jamaica Custom Agency. And with me is Mrs. Claudine Garcia Rattray, the Director for Post-Clearance Audit, and Mr. Perry Kent, the Manager for Post-Clearance Audit.
Thank you. I see Ms. Zimenez is here, who is our acting legal counsel. I think I've covered everybody who is here. Members, the minutes were circulated prior or before us. Are there any corrections to the minutes? Any amendments? If not, can I have a motion for the confirmation of the minutes? Moved by Member Brown, seconded by Member Cousins. In terms of matters arising, there are two matters that I'd like to address. The first relates to the former CEO, Mr. Allen. Mr. Allen, through his lawyer, had communicated to the Parliament prior to our last meeting that he was available, is available to appear before the committee, and in fact, he sent a written submission. The initial correspondence came to the Parliament the Friday before we met, but it was not brought to the attention of the committee clerk. So at the time we were meeting, we were not aware of that correspondence. Subsequently, his lawyer has indicated that he's willing to come, and he has confirmed that he will come to our next meeting scheduled for June 2nd. In relation to the current CEO members, you would have received a letter from his attorney and a draft response from prepared by the Parliament on my behalf. I think 4 members have responded affirmatively for the correspondence to go out. Member Cuthbert Flynn and Member Main, could you indicate whether you are in agreement with the draft that was circulated yesterday? If so, we would dispatch that to his attorney. It was sent via email. You can just use your mic.
So we'll respond electronically.
Oh, you responded to the email?
No, I'm asking you if...
Well, you can respond here.
Oh, very well. I'll just review the draft and I will comment accordingly.
Okay. You haven't had a chance to look at it. If you could, because we would like to respond to that correspondence, if you review it, and then you can either indicate here or via email to the clerk. In terms of matters arising there, I know the acting CEO, there were a couple of questions which arose from the last meeting, and I know you want to respond to a query about the sums that were spent post-Hurricane Melissa in terms of repairs. Could you go ahead?
Thank you very much, Mr. Chair. The request that came from the member was for us to explain the 913 million that she said in terms of damage that was carried to taken to the board in November. The Ministry of Health sent out to the hospital, a rapid assessment tool as the ministry wanted to determine what level of damage took place at the hospital. This was done, and I'll just give you the breakdown. It came up to a total of 941,800,000. The estimated cost of damage by the hurricane was 11 million. The estimated cost of places that were prior to the hurricane was damaged but made worse by the hurricane, that estimated cost was 441,500,000. However, there was also included in the list to come to the 941 a list of items that the hospital thought would be necessary to make the hospital more hurricane resilient. So it was not a damaged, it was more, if you want a better word, a wish list for things that could be done to help make the hospital more resilient. And that figure is 461,300,000. And finally, there was an estimated loss of revenue of 28 million. So that is what came up to the 941,800,000. Just to also add, Mr. Chairman, it was presented to the board in November. And in fact, at the board meeting, it was said that there would be a request for financial support. Our records indicate that such requests never went to anywhere, neither to the Ministry of Health nor to the Ministry of Finance. Even though it was said that there was a plan to, it never took place. So this was really not a damage of 913 million as was stated. But the breakdown is here, as I've shared.
Can you state how much was actually spent by the hospital in dealing with repairs that arose from the hurricane, the actual spend?
A lot of the repairs were done under the normal repair and maintenance contract that contractors would do on a monthly basis. Similar to what I shared at the last meeting about the procurement storage area, where the impact was severe, but the cost was very minimal because it was really just a patching that was needed to the thing that had lifted, the felt that had lifted. So at this point, there are a couple of areas that have actually been patched. Yes, it would be good to have a new roof, and that is what was being done in the estimate. Lots of new roofs around the property. However, we were able to do some amount of repair to put them in a state where they are not leaking. Yes, we have 1 or 2 leaks. Their contracts out, and that should be done within a month. Because I think there's one currently in the procurement process, as we have asked them to halt any work and make sure we go through the proper procurement process in the execution of those repairs.
Okay, thank you, Mr. Hosing. Members, any questions on that? If not, Mr. Benjamin, I know coming out of the last meeting, we had asked Customs to give us an indication of the entities that enjoy a similar tax-exempt status. I know you were compiling a list. I know you had clarified whether we wanted the transactions, which would have been onerous, but just to have an understanding of which entities enjoy a similar status.
Okay, Mr. Chairman. So we have categorized the entities. So there are charitable organizations, educational institutions. There is the exemption also for government projects for economic development, and these are where the government would enter into contracts, particularly with large overseas entities, and they would send those contracts down to Customs, indicating in the body of the contract that the items are to be entered duty-free. So for example, when we did the Southern Coast Highway, that would be one such project. Then there's also the $10 million monthly discretionary waiver that the minister gives, and that is published on the Ministry of Finance website. There's also the motor vehicle concessions. There is the remissions under their own act, like UE, the bauxite entities, the UTEC. Then there is diplomats and international organization. And there's also entities that are approved under the Fiscal Incentive Act. So we're talking about approved manufacturers, approved primary producers, mostly farmers would fall right there. Shipments for doctors/medical facilities that are approved by the Ministry of Health under the FIA as well. And that is a finite listing. I think it's limited to about 3 tariff headings. Then there is shipments for the hotels and attractions that are approved by the Ministry of Tourism. And there's also the shipments approved by the Ministry of Culture, Gender, for artisans, musicians, music producers. So those are the broad heading. If we were to drill down, it would be a large component because almost, for the manufacturers alone, we have like over 1,000 manufacturers that enjoy some concessionary benefits. If we are going to farmers, there are probably about another 1,000 farmers there that are registered under RADA that are entitled to benefits there as well.
And from a risk management perspective, what do you have a process to periodically either do an audit or do checks to determine whether the status is being used in the way it was designed?
Yes, we do. So we have both the post-clearance audit and we have our incentive unit. So the incentive unit works primarily with the approval process for the manufacturers. They actually visit the facilities, they look around, they ensure that they are in compliance, and they do periodic visits. In the case of persons who get certain products, they have to send in quarterly production reports. And from that quarterly production report, we will determine whether or not they are able to get additional benefits.
All right, thank you. In relation, the last time you were here, you had indicated that of the 4 entities that were identified by the Auditor General, you had completed a report on 1, but you were fairly advanced in completing the other 3. Can you provide us with an update on that?
Right. So they're not quite finished. They have in the process of reviewing. Each of them have different complexities. For example, let me give you a point. Then would have shown that it was imported by UE for UE. However, the one for Wilman Sales would have come with a purchase order from the university. You would have seen where the person with financial responsibility was Wilman Sale. You would have also seen UE as the declarant. So it was a bit different because it didn't show where they were trying to say that we had nothing to do with the shipment, for want of a better word. You would have seen where they would have properly declared that we have a purchase order from UE. We have presented that to customs. We are declaring that we are paying for it. They went as far as to say that the goods will not be handed over to UE until UE has paid them the monies because they are using a purchase order. We are going to check further because we want to know whether or not it was properly done in the first place, whether or not they actually had the capacity to utilize the benefit in that manner. Was it a part of the tendering process? Were all of the bidders aware that this was something that would have been available to them, so when they were doing their bid that would have been taken into consideration, or was this done on the back end? So that's the second part that we actually have to verify.
Are you in a position to give us a time frame as to when you think you can complete the other 3?
By the end of June.
By the end of June, okay. All right. Thank you. Members, any questions on what the head of customs just said?
I don't know if I was hearing the acting CEO correctly, but I
Sorry, Mr. Meehan, can you, because of the fans, just
Yes.
talk a little louder so we can hear.
Yes, I understand the CEO is trying to make a distinction between 2 particular companies. In one instance, he mentioned Jack Den, and I may be wrong, but I think he said that on the face of it, you could not say that the items were for the benefit of UE, while for the other companies, from the documentation, it was abundantly clear that it was connected to UE, up to the point that UE was, was the declarant in that particular case. So I don't know if he could confirm if that's what he is actually saying.
Right. So what we're saying, to be very clear, is that in the case of Jatden, you would have just seen an invoice. You would not have seen anything to connect Jatden, save and except when one went further and beyond the declaration to look at the bill of lading, and you would have seen that the address was their address, 18.5 Lindus Road, I think that is the address. But in the case of the Wilmot sales declaration, you would have seen where they would have declared on the face of the declaration that they are the person with financial responsibility, that they have a purchase order because they did provide said purchase order signed and stamped by the UHWI. So I'm saying that it is clear that there was some level of connection in that instance, but not so clear in the first instance because it was just the invoice. And we have come later now to find out that the shipment was actually for Jatden because it was at Jatden.
All right, thank you. Thank you very much, Mr. Benjamin. Mr. Chai Chow, I'm just going to ask you, again, you have introduced yourself, but just to indicate how long you served as board chair, and also Mrs. Thwaites, if you could just do the same as well so that we have a context in terms of the period of time you served on the board.
I was appointed to the chairmanship in November of 2022, and the board that I served was dissolved in December of 2023, early December 2023.
Good morning. I served the same period of time. My name is Catherine Park-Thwaites. I served as a board member and a representative of the as a University of the West Indies representative. I chaired the audit committee from January of 2023 when it was reconvened, although I was appointed to the board in November of 2022 until the board was dissolved.
Okay, thank you very much. We have received your written submission, and I will start, and members, I know members will have questions that they would like to ask. You have identified a number of issues which would have predated your incumbency as board chair. Could you indicate to the committee whether, on assuming your responsibilities as chairman, you were briefed on the issues that existed, and what was the course of action that the board took initially to try and resolve those issues?
There was very little brief given regarding the discoveries that the board made. In fact, we primarily were in a discovery period for the first 3 or 4 months of the board's appointment. Probably the only item that we were made aware of was the possible issue of governance, which is highlighted where the CEO does not have a seat on the board, but the Senior Director of Clinical Services has a seat on the board, but does not report to the CEO. So that was really the only major issue which I indicated that we were made aware of at the time.
In terms of that specific issue, what did the board, on discovering that which appears to be an inconsistency, how did the board treat with that? Was a report submitted to the ministry on that? How did the board handle that particular issue?
We appointed we had our HR subcommittee, which was headed by another board member, and they were asked to investigate the overall situation and make recommendations as to how we might be able to resolve this position. They were at a certain stage when the board was resolved. It did take quite a while because, as I think you've seen in other reports, this is not a new issue. This is something that has been brought to the attention of, I suppose, the ministry from as early as 1989, when a study was conducted by, I think, Mr. Leakey. So it's not a new issue. but it is a thorny issue that I think has to be resolved at some point in time.
All right. In terms of the Chief Audit Officer has indicated that reports highlighting challenges, and I just put it as challenges, were brought to the attention of the board for many years. Could you indicate what, and it's either for yourself or Mrs. Thwaites, who chair the audit committee, what were the major audit issues that were brought to the attention of the board, and how did the board treat with those issues?
Yes, the internal audit department produced quarterly reports, but the reports from June of 2022 to when our audit committee, subcommittee of the board, convened in January and February of 2023 had not been taken. In April of 2023, there were 3 firm recommendations made and accepted by the then board for management to follow up. The first was that there were 4 areas of significant issue that had been reported by the University Hospital Internal Audit Department. Payroll was one, procurement was another, custody of fixed assets, and planning. Those were the 4 main areas that had been highlighted on quarterly reports. Of those 4 areas, the recommendation to the board and per minutes that are available for the University Hospital board was 1, a special external audit needed to have been set up for reviewing the payroll matter. Management had already made some efforts, and they had in fact gone into court with people who had received monies inappropriately. But we required a further 100% audit of the payroll. On the procurement matter, we had asked...
Sorry, before you move from that.
Oh, sorry, yes.
The payroll issue which was flagged represented what I would term, I think you have used the term, ghost employees, persons who were being paid but who were not working. How large a problem was that? How many employees, and to what extent financially, what was the size of what was being paid out to people who were not actually working at the university hospital?
Okay, if you give me a moment, I'll pull up those numbers. I need to be clear that the internal audit did a sample over 3 months. The reason why we asked for the external audit and the terms of reference were given to the management, and in the board minutes there is an approval by the board asking for management to use the terms of reference and to hire somebody to come in, is that the board felt that although the amount was only about, I think, $40 million Jamaican based on the sample, and that the management had taken 4 or 5 people to court for recovery, the concern of the internal audit report, as well as the board, was that this was basically only a sample, and therefore the payroll records had to be reviewed for more than 1 year, 100%.
So you're saying you would have identified, if you want to call it, losses of, well, I use the term losses, but payments to persons who really were not doing work of about 40 million. To what extent would that what would have been the total payroll for the university hospital at that time? You have a rough idea?
No, I cannot share that because it never came up in any of our recorded minutes, and I would not like to hazard a guess based on memory.
Was that external auditor engaged to do the overall audit related to payroll?
The board presented the TOR and 3 possible members to go before the procurement committee. Based on my memory and the minutes that I have at hand, up to September of 2023, management had not proceeded to advertise and put the auditors in place to do the 100% check of the payroll.
All right, can I ask, I know there's the acting CEO and there are other senior members. Has there been an external audit done to determine the scale of the problem in relation to what I'll term the ghost employees.
Mr. Chairman, we will certainly investigate and give you a report in terms of the engagement of the external auditor. However, just to let you know that the total amount of overpayment was just about approximately $2 million for all 5 persons. These amounts were repaid after taking him to court, except for one who died prior to this happening.
So just $2 million?
Approximately, just over $2 million.
And is management satisfied that that is the extent of the problem, or have you done further checks to determine whether it's larger than that?
We are not aware of it being larger than this, but again, we'll have to check on that external audit engagement and whether that was done. I am not aware of it being done, but I need to investigate to determine if that was done and if there was anything additional found.
Okay. Member Brown, you want to ask? I'm going through, but you can, if you want to ask, go ahead.
Yeah, thank you, Chairman. I'll just ask a few and then. Yeah. Thank you, Mr. Chai Chung. Minister Tufton is on record as saying that the problem with the University Hospital of the West Indies is that it's systemic. There are toxic personalities, and that the board was dysfunctional. My first question to you, sir, is were you leading a dysfunctional board in the short period in which you were the chairman, and were you leading an environment, board and otherwise, that was toxic?
To answer the question about dysfunctionality, I believe that I had a very committed board that was invested in the best interests of the hospital. As to why the minister would have considered the board dysfunctional, I think that's a question you will have to ask the minister himself. The toxic environment, there are challenges at the hospital. There are very strong personalities. But more so, what's necessary is that you need strong leadership that is acting towards a plan, which did not exist when we took the seat at the hospital. There was no operational plan, there was no strategic plan. So in essence, you have an institution that is underfunded with many, many different interests competing for the scarce funds that are available. So you end up in a situation that he who talks loudest gets most attention.
Yes.
So from that point of view, maybe that's considered toxic. Sorry, the other aspect of your question? The other part of your question, please?
Sorry, I'm not hearing you.
The other part of the question that you asked, I think there were 3 points that you made, and I asked,
toxic, dysfunctional, and that the board. I think you answered all of them: systemic, toxic, and dysfunctional. When your board under your chairmanship was empaneled, it was the second board that would have been empaneled since the 2020 new term. Yes. I only saw this document this morning in terms of the submission that you made, but you listed about 15 different challenges and maladies that were facing the institution when you assumed that yourself and your board assumed the leadership. You indicated on page 2 that the greatest imperative of the board was to appoint a permanent CEO. Can you elaborate as to why that was the greatest imperative of the board as you saw it?
well, certainly as a board, the person that is most important to us is the CEO, who we will hold accountable for the performance of the institution. You needed to have someone in place who is permanent who is conducting the activities and the goals of the institution. And it's a situation where you want someone who is going to be acting for a period where they can make a difference. So we had to answer the question as to whether the person who was acting was suitable for the position or whether it was necessary to bring someone else in with other capabilities.
Okay. So you essentially believe that the CEO was critical to lead the institutional reforms and to address the challenges and maladies that you had outlined?
That would be correct.
All right. Could you, and before I continue, Permanent Secretary Green, is it the purview of the board of the University Hospital to appoint the CEO of the institution, or it is the minister who does that? Just for clarity.
The board.
The board. All right, thanks. So it was in good stead, and in terms of governance, the duty of the board to appoint the CEO. Could you walk us through the process that you then executed as to addressing the greatest imperative of finding a new CEO for the hospital?
Certainly. In the board discussions, it was contemplated whether the board was in a position or not to recruit without external help a CEO. The board made a decision that the position was so important to the institution that we should solicit the services of a professional headhunting recruiter. We did so, found our appointed entity that had a very strong reputation. This company has done hiring for the government of Jamaica and several leading institutions in the country. An international search was launched. I would also indicate that in bringing this professional on, there was a question as to the salary levels that would be needed to attract the type of person that the hospital needed. And the government of Jamaica guidelines for the post, the HR professional indicated would not be sufficient to attract the type of person that we were looking for or that we thought was necessary to lead the hospital. To support that, we sought the support of the Ministry of Finance, sought permission from the Ministry of Finance to get additional support from private sector to augment the salary that would be offered for the position. And I think we got support from a number of companies for a period of 3 years to do that. Once the support was confirmed, the search was conducted. We had 90 applicants for the position. And the professional
90 or 19?
90.
90, okay.
Right, 90, over 90 applicants for the position. And the persons who applied had a significant amount of experience in hospital management. They came from the applications came from as far away as the UK and Australia. We had regional persons, people from the US, and local as well. There was a short list created by the HR team, HR professional consultant, of 6 persons, and we included the acting CEO at the time to make a total of 7 persons for the short list for final interview by a panel selected by the board.
All right. So you, in your presentation, the submission, you indicated that the process went through and candidate was identified, and that candidate came to Jamaica and went through a sort of a orientation. There was was an issue that the candidate raised. Can you, walk us through what that issue was?
The candidate indicated that the most important person for them to be able to achieve the objectives of the institution was the Senior Director of Clinical Services, and in their experience in the other organizations that she was, beg your pardon, that the person was in charge of. I suppose. Yes, it was a she. Right.
You know her personally?
Not before this.
But you know it's a she?
Yes, I do. Right. Right. The most important person to the management of the institution would have been the Senior Director of Clinical Services, who would be the person that she would, that would be lent, I can say she now, I guess. She would lean on most for the clinical governance of the institution. So that person needed to report to the CEO position, and the issue was that having been here for the period that she was, she determined that there was a problem with the reporting requirements or authority of the position. She felt that unless she could be guaranteed by the board that we were able to resolve that position, that situation, she would not be able to effect her duties.
Okay. All right.
So that's the same issue flagged where the senior clinical director reported to the board and not the CEO, and that the CEO did not have a seat on the board.
That is correct.
Okay. Yep. All right. So, and I suppose based on the flow of your submission, the candidate did not take up the position because it could not have been resolved to her satisfaction.
The candidate was willing to take up the position, and in fact, I was scheduled to take the position up in February. A contract was, however, not signed because she was awaiting the confirmation from the board that we had a resolution to that problem.
Okay. All right. So after after the person. No, he said she. I don't know if it's a he or a she, but he said after the candidate, this the preferred candidate who was selected through the process, did not take up that role. My understanding from your submission is that the board, in its right, moved to appoint a new acting CEO. Is that the case?
That is correct.
That's the case. And the reason, so remember? A new acting CEO. That's the case.
That is correct.
Yes. Flowing from that, though, I see here, which I find particularly profound, the day after the board, and it's your submission, I'm reading from it. The day after the board announced the appointment of the new acting CEO, the Minister of Health overturned the board's decision and reappointed the previous acting CEO. So, I asked earlier the permanent secretary, whose responsibility is it to appoint the CEO of the institution? Is it the board or the minister? So before I ask you to respond, was that move as stated here from the submission of Mr. Chai Chong, was that move by the minister to reappoint the previous acting CEO improper based on governance? PS?
I could not answer that because I do not know that to be factual. I couldn't answer because I did not know for a fact that the minister appointed the CEO. So I could not answer that question.
Yes. Okay. No, I'm not talking about hearsay. This is a submission that was written.
There's a submission.
It is page 3. You can read it, member. Mr.
You have a point
Chaicho.
of order?
On a point of principle,
What's the point of principle?
that you have allowed a member to be asking 15 questions on a trot, and I've had my mic on, and you did not acknowledge me or anybody else.
I know, when he's finished, you'll
No,
get
I
an
can't
upper.
wait until
I
it's
just
No,
have-
no, but
Chairman.
he's,
Yes.
he's
Chairman, that's not
member,
how the chair.
member Clark.
Yes.
You always get an opportunity to ask your questions.
Don't worry about me getting an opportunity.
And every member
but you
here
can't know one
does.
member for the
But
game.
he's asking questions
I
based
Mr.
on the
Chairman,
submission.
man alone don't run the
I have
committee.
But
two
he's
more,
not the
my
only
brother. I'll
person.
be
You
finished.
will
Fine,
get
so
an
15
opportunity.
15 questions, him alone.
He hasn't asked 15 yet.
You're not
I'll
even
allow-
a keep count. 15 questions.
He hasn't asked 15.
All right,
I will
member,
allow
I
him to
have-
ask
I
his
have only
questions.
two more.
Mr.
And then
Chairman,
you
I'm
are,
here, sir.
and you will get your opportunity to ask.
So, Mr. Chaicho,
Let me just say, the order I have after Member Brown, Member Clark, Member Main, and Member...
let me just finish.
He hasn't asked 15 questions.
Right, Mr.
He
Chair.
hasn't asked 15.
Mr. Chair,
Yeah.
at the committee level, we have a convention that we would allow one member to do maybe 3 to 5 questions, and then we allow other members, and then if it is necessary, then that member can go back and answer the question. It's really a
Chairman, I have
convention
two
that
more
we
questions
established.
to wrap up.
Member Witter, and Member Clark. Every member in this committee has got their opportunity to ask questions. I have never stopped a member from asking questions. I've never, right? You have got many opportunities to ask questions. You got it the last time, you got it the time before. You're not, let me just be clear, you're not going to bully me in terms of how I manage the meeting.
That's right.
Right? No, but then, well, don't come down, don't go down this road. Do not go down this road because you get, yeah, but you are shouting. And it's not necessary because you get an opportunity to ask questions.
Mr. Chair,
every member of the committee gets an opportunity. So don't go down this road.
I'm just reminding you of the convention that we have established.
I understand.
Yes,
Once he's finished, you can get your questions asked. Go ahead, Member Brown.
Thank you, Chairman. So, Mr. Chaichong, on page 3 of your submission, paragraph 3, you indicated that the minister reappointed the previous acting CEO. Are you standing by that wording as it relates to your submission, sir?
It is my understanding that the minister had a meeting.
What is it? Mr. Chairman, what we doing inside?
Can you
A question has been asked. Mr. Chaicho has the right to answer the question. He has given a submission, and questions are being asked based on his submission.
Read it.
You'll get an opportunity when you're finished to ask any question you want. But he has a right to answer the question.
All right,
Go
so
ahead, Mr. Chaichong.
Sorry, Mr. Chaichong, you're responding.
Yes, it is my understanding. I was not there. I was not present at the meeting itself. It is my understanding that the minister called a meeting of the hospital senior staff and indicated...
Mr. Chaichong, go ahead, please.
Indicated that the previous acting CEO would have taken the position or that his appointment was being renewed.
And finally, members, why did you resign?
Well, I felt that if the board had taken a decision, which is one of the most critical decisions that a board has to make as to the position of the CEO, and if that decision was being overturned, then in essence, the board was being told that it had no power. And I was not willing to continue serving where imperative or where decisions of the board could be overturned without any kind of consultation with the board.
Thank you. Thank you, Chairman.
Yes. Mr. Chaichong, I just want to pick up where my colleague has left off. This meeting that you said was called by the minister, were you present?
No, I was not present.
Okay. And notwithstanding your absence, you resigned based on a decision, according to you, that the minister took that was never communicated to you.
Why do you say it was not communicated to
Because
me?
you said you were not at the meeting. Was it ever said to you by the minister that he intends to have the previously acting CEO reappointed?
Yes, he did.
And when did he say that to you?
Prior to his visiting the hospital, I was called into a meeting at the minister's office where he indicated that this was the action that he was about to take.
Okay. And you resigned at what point?
After I was informed that the action had been taken by the minister at the hospital in a meeting at the hospital.
But Mr. Chong, would you agree that the administration of the hospital falls squarely or is led by the board of which you were the chair?
Yes?
Yes. And it is very unusual.
Member Main, go ahead.
Yes. I want to put it to you, Mr. Chong, that the minister did no such thing. And that you are upset because the minister described you as being dysfunctional. What do you have to say about that?
Well, I believe the description of dysfunction took place long after I resigned. So in that situation, your assertion that I did so because I was being, or my board was being described as dysfunctional, would not be correct.
Did you part ways as head of UHII and your appointment by the minister? You said you resigned. According to you, so will you agree with me that the minister fired the board of which you were the chair at the UHII?
Well, I was not at that board meeting.
You were fired. The board was fired by the minister.
The board was dissolved, whether you consider
By
that
the
firing
minister.
or not. Yes, it was
Yes.
dissolved by the minister, whether it's considered a firing or not. That's
Yes, all right.
That's
Yeah,
up to public interpretation.
Good.
Member Clark, you want to ask your 15 questions now?
Well, stop me.
No, I won't stop you. You have all the time to ask any question you want.
Mr. Wayne Chai Chong, I'm going to read from a document that was submitted on November 23rd, 2023. At the time, it is written to Mr. Dunstan Bryan, who was Permanent Secretary, Ministry of Health and Wellness. And the paragraph that I'm going to read.
Can you just state what that document is? The last time somebody did that, you were very clear that documents not tabled, we must know what is being read from.
Taylor Hall University of the West Indies, Mona campus. It is a, right? So I'm going to say to
No, tell us the document that is being, you're reading from. Since this is not before us. You remember how you behaved the last time a member referenced the document. Can you indicate which document you're reading from?
allow it to happen.
Can you indicate
So,
which
Mr.
document
Chairman,
you're reading from?
I am going to ask a question, sir. The person that was chosen by you, the same she, how old was that person? Not by the process, by Mr. Chai. Because Mr. Chai is the
No.
one that made mention. It is
No.
a she.
No, sorry, sir. I do not take decisions. The board takes decisions.
The board?
The board takes decisions.
Did you authorize at any time payment for that person traveling?
Yes, the board.
Why? On what grounds?
The board authorized payment for her travel.
No, not the board. You, Mr. Chairman.
No, sir. The board authorized.
The board did not settle off on it. And you, Mr. Chairman, instruct the board to pay for traveling not only for the person, but also for the person's spouse. Are you aware of that? True or false?
Not aware of the spouse.
You're not aware of the spouse, but
our expense, not aware of expenses for the spouse being paid.
Why is it?
Member, can you reference what you're speaking from?
I'm trying to get in my 15 questions.
He has some knowledge of it. He's answered. You were at large. You were at large. Allow him to ask this question.
So why are you so concerned? So allow him to respond. Back to you, sir.
Right. Not aware of the board authorizing payment for the spouse's travel.
Did you instruct the board to do so?
Authorizing payment?
Yes or no? The payment?
The board authorized the
no,
travel.
not the board. The board was already not settled on the idea of employ the person. I am asking the gentleman, is it true or false? Am I telling a lie?
The board indicated that it wanted to see the individual and complete final due diligence with that individual. And that individual lives overseas. That final due diligence is necessary to be conducted on here in Jamaica.
You're not answering the question, sir.
Go again.
Did you authorize, did you instruct, did you ask, did you recommend any one of them, the board, to pay the traveling amount to the person that came from wherever you say she came from?
Again,
now,
sir.
obviously, you know that it is a she.
Right. Again, sir. The board took the decision.
No, it's not the board, Mr. Wayne.
But he has answered, you know. Him said the board.
It's not the board. Let me ask you the question. You say the board, you didn't have a taxi board. But how is it that the committee, is there a committee that dealt with the interview of that person?
Yes.
And what was the recommendation?
Of the committee?
That same board. That same committee, sorry.
The recommendation was to hire.
And why did the board refuse? Explain, carry us through. What happened?
Refuse what?
Yeah, with refuse, sorry.
Refuse what?
Yeah, that was, I was
Mr. Chairman, allow the gentleman to
no,
answer
but
the
you have
question.
asked refuse what though?
No, but you don't know, Mr. Chairman, I'm talking to Mr.
But he
Wayne.
doesn't know
Unless
either.
you are now the
I'm
former
asking
chairman.
refuse what? Refuse what?
Right, that I would seek that clarification as a member.
Mr. Chairman, the gentleman is sitting across from us. Please do not give the gentleman questions.
Refuse what?
You're answering me through the chair. Stop me when you think that you should.
Sorry, member. I'm seeking clarification from you when you indicate you asked the question refused, and I'm not certain what you're referring to when you say refused.
You're all right. You don't understand where we're going. You don't know where we're going.
Member Clark. Member Clark. Mr. Chai Chong is asking for clarification on your question. He's asking refuse what? The same thing I'm asking.
The board in session at the time, when the document came from the committee.
All right, let's make it, go ahead. Go ahead. Go ahead. Go ahead and ask your questions. Go ahead and ask your questions.
You don't know brief, man.
Member Clark, why you don't ask your questions?
If you will allow the gentleman to say.
No, you are being distracted. Ask your questions.
I am asking you now, sir.
Yeah.
The person, the she, that was brought in. I don't know if it's a lady. Mr. Wayne said it's a she.
Member Clark, just focus and ask your question.
I am focused, sir.
But you're being distracted.
Oh,
Don't allow
so
yourself
you
to be.
agree, but you're not doing anything about it.
Don't allow yourself to be
But you're
distracted.
not doing
You're
anything
one of the
about it.
worst distractors, so go ahead.
Mr. Wayne, once again, sir, did you instruct payment for the traveling of the she?
I believe I've answered that question a few times, but I will repeat.
Sir, I'm asking you again.
I will repeat.
Yes or no? Did you?
I will repeat, sir. The board authorized payment.
And did the board authorize that payment?
Sorry, I responded affirmative to that.
I asked you the question, did you? You said the board is the one that should authorize. I'm asking you.
I did not say should.
Should.
I did not say that, sir.
So it is not should. It was.
That is correct.
And what was the sum that was paid over to the person?
I cannot recall.
You can't?
No.
But you know it's a she?
Yes.
And you can't recall the money that was paid over to the she?
I do not believe. No, I cannot recall.
And you were a part of the board at that time?
Correct.
And you were the chairman?
That is correct.
You know it's a she, but you don't know the money that was paid over?
I cannot recall the sum.
You know, I came in here this morning and I looked at your face and I said, here's an honest man. But then you take all that away from me just now.
I don't think you should go there. And remember, I don't think you should go there. Don't go there. Don't go there. And before you go there, let me just say this. And maybe the permanent secretary can indicate. We have Mr. Barrington from Finance. In scenarios where there is international recruitment and a candidate is shortlisted, what is the practice in terms of dealing with the shortlisted candidate who you would need to physically bring to the island for interviews or further, if you want to call it verification before making a decision? Is there a practice within the public service for how matters of that are treated if you're doing an international recruitment?
Chair, unfortunately, I'll have to get that clarity from the appropriate office at the Ministry of Finance, but a general thought prior to me getting that clarification is that an interviewee would foot the bill to facilitate his own interview in other part of that recruiting process. Unless it's some previously contractual obligation or agreement, then I'm not seeing where the ministry or the government, the public sector, would facilitate such travel. But I'd have to give a full clarification after getting it from the relevant section of the Ministry of Finance.
Okay. All right. Before I go to Member Main, I just want to welcome 29 students from Marymount High School in St. Mary. I know you wear a uniform which is similar to another school. Is Southeast or Central? Is Southeast? Okay. And your teachers who have journeyed here for the sit-in, and I assume you're going to stay for Parliament, which convenes at 2 o'clock as well. Welcome, and I hope you enjoy and learn from the sit-in. Member Main?
Chairman, I just want to pick up from where my colleague Clark had left off. Just a few questions along the same line. Mr. Chong, the selection process, was that done by a HR subcommittee?
Yes.
Yes. Were you a part of that committee?
For the final interviews, yes. Prior to that, no.
Okay. So it is throughout the final interviews where that recommendation would have been made. Coming out of the final interviews, you would have made that recommendation.
The committee would have made that recommendation.
Yes. Committee, you're a part of it. Now, the preferred candidate, was that person an ordinary resident in Jamaica? As in, did the person live in Jamaica?
No.
Okay. Was that person as part of the interview process? Did you get certain critical information about that person to include their age?
Their age would have been included.
Yes. So is it correct that the preferred candidate was somebody who had actually attained the age of retirement?
The question of retirement age was not one that was raised with us initially at the board level.
Yes.
However, we sought clarification once it was brought up, and we were satisfied at the board level that that was not an issue.
Okay. So, notwithstanding the age concerns that you have said was ratified, would it be correct to say that the board at the time, considering everything, was not settled on this recommendation of hiring somebody who lived overseas?
The board ratified that decision.
Okay, very well. No, I know everything. So if it was said, Mr. Chong, that the matter of the airfare for the persons to travel overseas, that the board was against it, paying the fare for the person to travel from overseas to come here to Jamaica, would I be correct to say that the board was not in support of the payment of the airfare?
That would be incorrect.
Okay, very well.
You have to press your mic, you should know that. You have to press your mic to be recognized, No, man, you have more questions? Oh, because you said I was preventing you from asking, so that's why I'm asking. All right. You don't have any more at this point. Okay, all right. Members, are there any further questions for Mr. Chai Chong? Yes, Member Corporate Win.
Thank you very much, Chairman. Mr. Chong, thanks for being here. I wanted to find out, during your tenure, you listed so many deficiencies that was taking place at UHWI. Was there anything you mentioned, strategic or operational issues, management issues? There are many challenges. You said management had challenges in developing a budget for approval of the board. Operational and financial procedures and controls were not being observed consistently. Staff morale was low, exacerbated by management culture of intimidation and bullying. Just guidelines for GOJ procurement were not consistently adhered to. As the chairman of the board for the time that you were there, were any of the things that you mentioned, approximately 15 or more, were there anything that you were able to actually put in place as the chairman?
There were a number of things that we looked at having to start to correct. And the major challenge is that as we are not an executive board, those corrective actions have to take place through the management team. So we try to work with management to improve a number of these areas, but it would have been left to management themselves to execute the initiatives that we as a board felt were most important towards the hospital.
So basically the board didn't have any power? Is that what you're saying? That the board was powerless? You have policies to execute, but you couldn't do it because it really was left up to management alone? What was your power? What was the power of the board to actually direct and to make sure that some of these things were instituted?
Well, the ultimate power of the board would be to take sanctions against management, or the management that reports to us, which would be the CEO. Right.
Member Cousins.
Thank you, comrade. Thank you, Chairman.
Chairman here. Chairman here. I said chairman here. Chairman here.
Yes,
here. Here. I could say you used to be one too. Anyway, go ahead, Member Cousins. Go ahead, Member Cousins.
Thank you, Chairman. Mr. Chung.
Speak in the mic because...
Mr. Chung, I see here where in your report you indicated that ghost employee accounts were detected at some point in time. For avoidance of doubt, what do you refer to as ghost employee accounts?
Okay. Thank you. If I may help, the word ghost accounts was used by the Internal Audit Department of the University of the West Indies, and what it meant was that there were names on the payroll and the bank accounts that those names were attached to were in fact not bona fide employee bank accounts. That's why it was called a ghost account, but it's actually a nomenclature used by the Internal Audit Department in their written audit report.
Thank you. Do you have any idea how many of these ghost employee accounts were detected at the time?
Standing is that I think Mr. Hussein answered that a little earlier when he said that there were 4 or 6 individuals amounting to 2 million, but that was Mr. Hussein who answered the question.
And so, Sir Hussein, you're saying that what steps have you taken since all of this to ensure that there's not a reoccurrence of this employment practice or this practice overall?
As I shared with the chairman, I will be investigating this matter and providing a proper report to the PAC in short order.
Thank you, Chairman.
You ready now? Then press the mic now. Yeah, man. You have a long run.
Through you, Mr. Chairman.
Long run.
Through you, Mr. Chairman, to the PS. And if I am permitted to ask this question, what's the salary for the present CEO?
In the region between $10 and $11 million.
$10 and $11 million.
Yeah.
Does he get security?
No.
He doesn't?
No.
He gets accommodation?
Not to my knowledge, no.
Not to your knowledge?
Not to my knowledge.
Through you, Mr. Chairman, to Mr. Wayne.
Sorry, Chairman, through you. I understand that he has housing benefits.
He has housing benefits.
Yes.
Fine, fine.
Ask your question, Member Clerk.
Mr. Chairman, the person, the she, that Mr. Wayne Chai Chung alluded to, sorry, the board would have made the decision to employ that person when you were there?
If the board would have made that decision to employ
Did the board make a decision to employ her?
It was, yes, it was a decision
What
from
was
the
the
board.
salary package that was offered to the person?
I believe the salary package would have been in excess of $20 million.
What is the excess?
Sir, it's been almost 2.5 years since
And you
then.
don't remember
I don't
that
remember the
either?
exact number, but I do remember that it's over 20 million.
You're sure the excess did not bring it up to around $33 million?
I don't think it was that high.
You're sure?
No, I cannot be certain.
And if we should ask for the minutes of that board meeting, would it reflect the $33 million or just 20-something million?
I would not be certain. I couldn't answer that question for certain.
So Mr. Wayne, did that she offered security? Sorry. Security.
Physical security?
Yes.
No, she was not.
She was not. And the minute won't reflect that.
Not to my knowledge.
Not to your knowledge. Thank you, Mr. Chairman.
Mr. Chair, with all of these questions, I think I would want us to ask that the minutes, if we can get the minutes.
Of which,
for the questions that we just
far?
asked for, especially regarding the employment, because a statement here was made that the board announced the appointment of the new acting CEO and the Minister of Health overturned that board decision.
Mm-hmm.
I would want to know the reasoning behind that, because something was put here on paper. Minister is not here to respond, so I think what I would want to see is the minutes for that meeting and what was stated. Thank you.
I would, so could you indicate the date of that meeting? So just to be clear about what we're asking for, it would be the minutes of the meeting that took the decision to overturn the appointment of the recommended CEO. Is that what you're asking for? All right. That would have to be directed to the acting CEO now. If you could provide that to the committee.
Okay, Chair.
Okay, and also the minutes of the meeting that would have agreed on the remuneration package for the candidate who was offered that position.
Okay, Chair.
Okay. Go ahead, Member Witter.
Thank you very much, Mr. Chair. This question is for Mr. Chang. Do you believe that it is a wise decision to if you are looking at employing a new CEO and you advertise the position, during that
Member
time,
Witter, speak closer to the mic because of the
during
fans.
that time there's an acting person, someone who is acting in the position. If that person does not contravene his position as the acting CEO or resign, do you think it would be wise to have him continue until you find a new CEO?
The reason that we chose not to renew that acting position or to extend it is that the person had been acting in the position for 12 months consecutively. We received advice from the HR department of the hospital and also from the legal department of the hospital that if we were to renew it for a further period, the person who was acting in that position would have had grounds to possibly challenge for the position to be made permanent. That is the reason that we chose not to do so. That is the only reason that we chose not to do so.
You have any more questions, Member Witter? That's it? Okay. Member Brown, you...
Sorry, Chairman. Just one final question, just for clarity. The Mr. Chai Chong, the acting CEO that was reappointed by the minister based on your submission, is that person the present CEO? Just for clarity.
I believe so.
Okay. All right.
Member Clark, you have questions? For now. But you see, you get any opportunity to ask all your questions. You have to what? You start with yourself and then everybody else. Okay. Members, are there any other questions that we have for Mr. Chai Chong? You said that in your submission were you aware that the university hospital enjoyed the tax exempt status and that you said you were not aware of any abuse of it, but were you aware of the benefit that the university hospital enjoyed with the tax exempt status?
Yes, we were aware of it, yes.
And from your understanding, under what circumstances could the university hospital utilize that tax exempt status in terms of the procurement of goods and services?
Primarily through the importation of goods without any customs duties and the exemption from GCT as well.
And typically in doing so, would that be done typically through a procurement process where a third party is identified and that third party would bring the goods or the services in on behalf of the university hospital?
For the most part, I would expect so, although there would have been I would expect that there would have been direct purchasing once the amounts fell below a certain level.
Okay. In terms of were you aware at the time of your incumbency of the issues related to the absence of a tax compliance certificate for the university hospital?
It was never brought to the attention of the board.
It was never brought to the attention of the board?
The absence of a tax compliance certificate was not brought to the attention of the board.
Wow. Well, let me ask the question then. When or how did you become aware of that? Was it after your term had ended?
Correct.
Okay. Okay. All right. Members, any other questions? Yes, Member Corporate.
Yeah, I just wanted to go back as far as did the board members ask for the medical records for the person the preferred person that you had chosen? And did they ask for that document and another document, and possibly when those documents were not presented, that's when the board was dissolved?
Not to my recollection. We did not, as I said, recall having to ask for medical records. The HR professional was charged with checking references and doing all the due diligence on that individual.
Well, because of the advanced age of the person, did they ask for the medical records for that person? And
no,
was that given to them? Was that? Was that given to them?
I do not recall that it was done.
Was the board dissolved, or was it, because I think you mentioned, and I think I'm having a difficulty, especially when someone is not here, the minister is not here, when you said that the minister, you know, overturned and the board's decision. Was that the minister who did that, or pretty much the board? Because these things were not given to the board, that's the reason why the board was dissolved.
Again, I cannot speak to the reason that the minister dissolved the board. I can only speak to the minister indicating and having a meeting with the staff or the management of the hospital on the day that I resigned, where it was indicated that the then acting CEO would be reappointed.
Okay, no more questions for that.
Okay. Mr. Chai Chung and Mrs. Park, Mrs. Park Thwaites, let me thank you for being here and thank you for your submission to the Public Accounts Committee. There are no more questions. Is there anything else that either of you would like to add beyond the submission that you've made?
Not for me, Mr. Chairman.
Okay, thank you very much. Members who, in terms of where we are, we had gotten through to 4 of the 7 issues that were highlighted by the Auditor General. Only 4. There was item 5, 6, and 7. And I'm just going to try and see if I can find those documents so we can go through that in the interest of time so that we don't have to have the officials back here. Sorry, if you wish to leave, you can do so. Okay? Let's just try and identify. We're going back to the original Auditor General's report. We had gotten through to items 1 to 4. We're going to deal with items 5, 6, and 7. So members, if you want to pull up the documents electronically so we can just follow. And for the members who have not responded to, oh, we have the prompt here? Okay. Okay, we can just share. Let me remind the members, those of you who haven't responded to, how many? I think most of them have been answered. I think. All right. Let me just identify. Huh? You have a question?
I'll answer in the affirmative for the email.
Oh, okay.
I don't have to.
Okay, so you're okay with it going out?
Yeah.
Okay, thank you. Members, the key finding number 4 was the misuse of the tax-exempt status. I mean, we have had an exhaustive discussion on that. I don't know whether there's anything further that can be added on that. We await from Customs the reports from the other 3 entities. Key finding number 5, the after the fact procurement activities. Again, I believe we have had an exhaustive discussion on that particular matter. Key finding number 6, the use of the private wing for procurement. I think that was an issue which arose related to the absence of a TCC, and that matter has been, I believe, fully ventilated. And key finding number 7, the other procurement irregularities. related to hiring consultants and other service providers. Again, I believe the University Hospital has addressed those matters. So while we didn't go item by item, I believe the discussions that we have had over the last couple of meetings have fully ventilated the issues. So I don't know if members have any further questions related to the key findings. If not, I would ask that we adjourn. Our next meeting date is June 2nd. June 2nd, and I look forward to seeing the team from the ministry, the team from the University Hospital. I never look forward to seeing you, no. I'm sure your wife does, but not me. I look forward to seeing all of you at our next meeting. Could I have a motion for the adjournment, please? Moved by Member Cousins, seconded by Member Clark.
Thank you, Chairman. Thank you, members.
Thank you also, the Chairman.
We want a piece for Jamaica. Yo, what are you? Oh, man, none of that. No, brother, no, man. Mash up that, man.
See you ever play ref? Dirty game,
Yeah,
man,
but
play.
I look a bad game. No, I said, person, you come from, brother, I want to live good, man. I want to live good, Bridging. No shake hand, I can play a little bad, Bridging.
Really have to shake hand?
Yeah, man, and no badness, Bridging. Just live good, man. Come together, and make the violence done.
In our funded and focused feature, in the pathway for entrepreneurial funding, the 90-day cycle of compliance can be made more bearable with AI. So let's unpack what AI does for your compliance foundation of your funding plan for your business. So let's pick on one AI tool. For example, Claude.ai becomes your compliance research assistant and document drafter. So here is, if you can imagine, a practical workflow. So you describe your business structure and current situation to Claude.ai. Claude.ai then helps you identify every gap, missing filings, wrong structure, missing documents. Guess what? The AI tool also drafts the letter, the resolutions, and the correspondence you need. It can also build you a compliance calendar with deadlines specific to your entity type and the jurisdiction where your business is registered. AI can help you prepare the compliance document package that you will attach to every proposal, every grant application, and loan request going forward. And that package typically includes your certificate of incorporation, your TCC, your last 2 years of financials, your business bank statement, your GCT registration, if applicable, and your business registration certificate. When you can produce that package cleanly and quickly, you have crossed the threshold from hustle to operation. So what do you do this week? The first step is an honest audit. Before you can fix anything, you need to know exactly where you stand. Use Claude.ai to walk through this with you. Describe your current setup, ask it to generate a compliance checklist specific to your business type and the types of contracts and funding you are targeting. That checklist becomes your roadmap.
PBCJLC, the regulatory body. We regulate, you play without worry. We regulate, you play. PBCJLC, fair play when you play. For the fun of the game, you know where they are. PBCJLC, keep it fair for the player. You play the game and we are the rules setter. Keep everything fair so the game play better. The Betting, Gaming and Lotteries Commission. We ensure fairness, integrity and responsible gaming practices. Keep the game fair and fun for everyone. We regulate, you play.
The moment Jamaica has been waiting for is finally here. The spectacular PBCJ Kiwani's Little B spelling competition. Get ready to witness the next generation of champions as our youngest stars, ages 5 to 7, take the stage to showcase their spelling genius. Watch as over 20 schools compete in an electrifying spell-off, vying for a spot in the grand finale and to claim the title of Jamaica's top young spellers. Who will rise? Who will shine? Who will become the next spelling superstar? Find out in this thrilling showdown of talent, courage, and determination. Tune in on Saturday, May 16 at 8 p.m. on PBCJ, the People's Station, with a rebroadcast on Sunday at 6 p.m. Bring your family, cheer for our bright stars, and to celebrate the power of education and dreams. Because at PBCJ, we believe in nurturing our future, one word at a time. Don't miss the event of the season, the PBCJ Kiwani's Little B Spelling Competition, where every word counts and our youth shine brightest. Only on PBCJ, the People's Station.
The following is brought to you by the Office of the Prime Minister.
Your government is empowering you through education, training, and development. That is why we have removed all fees for every Jamaican accessing training through the Heart NSTA Trust. So, whatever you desire training in, food and hospitality, beauty and cosmetology, housekeeping and hotel management, welding, carpentry, masonry, or any of the dozens of programs Heart offers, you can enroll completely free and change your life. We are building Jamaica.
The proceeding was brought to you by the Office of the Prime Minister.
In a world full of noise, it's easy to miss what really matters. That's why we're here. Why it matters. Discussions that break down the issues you didn't know you needed to know. The stories over